Hello everyone. I'm coming straight to my point by stating three examples. All of you must have gone through it. Imagine you are in your second year undergraduate. You are in the Viva. Teacher, you go in. Teacher asks you, "Beta, what is this?" You say, "Sir, this is adrenaline." What is it used for? Sir, shock. Okay, what is shock? You think a little, you act a little, and you couldn't answer that. Somehow the Viva went well. You come out, you say that, "Yes, sir, that's a nikal gaya." Now, cut to 4 years ahead when you are the intern of the same medical college. Now, a patient comes with shock. Okay, you somehow know that it is shock, pulses are feeble, but you don't know the treatment. You Fortunately you have a senior with you. A senior helps you out in that situation. You revive the patient. Uh, the patient is clinically stable now. You feel good, but somehow you feel that I could have done something if I would have known something extra. Now, cut to a situation where you are out of your medical college and you are in a situation where you are everything. Your decision is all in all. Maybe it is a CHC, maybe it is a PHC, maybe it is a medical college, anything else. Now the patient comes, you know it is shock, pulses are fever, consciousness is low, urine output is low, the extremities are cold, but the resources are limited. The point I'm stating is that by the time we advance, by the time we go forward in our medical curriculum, the priorities change. The things which do not, which have a very less significance in the earlier days, become very significant in the later days when you come into clinical practice. So you have to study. The basic is that you have to study. You have to have basic knowledge about everything. If not advanced. You have to study for knowledge. You have to study for counseling. You have to study for, say, money. You have to study for, say, fame. You have to study to save your back. So in this channel, in this Pediatric Simplified, which will be under Clinical Simplified, we will study how to think as a doctor, how to relate things that we study in theory to what we see in the ward. Understood? So let's start it in a simple, in a relatable, in a clinical way that everyone can relate, and we can think. Maybe you are in a first year, maybe you are preparing for entrances. You should think like a doctor, not the when the patient will come, it won't have any question written on the head. Understood? So you have to think as a doctor in the initial days to treat the patient physically. So let's go. Let's start Pediatric Simplified. Wait for the first video. Thank you.